Request an update on mental health impact on law enforcement. Chief?
Mayor, members of council, I appreciate time you giving me this evening. Councilman Meza asked for a little update on the mental health issues that we've been dealing with. So this is kind of an informative session just to kind of let you guys know how it works and what we're dealing with. So here's kind of what we're facing. Virginia State Hospital census experienced a 294% increase in civil temporary detention orders, which is what we call TDOs, admissions from 2013 to 2018. Statewide DBHDS, which is the Virginia Department of Behavioral Health and Disability Service, state hospital has been averaging a 96% census capacity, and at times it's inflated to 98 or even 100% capacity. This is clearly it's not a sustainable trajectory, and while DBHDS is experiencing increasing pressures, the overall number of statewide TDOs has been holding steady at about 25,500 per year. At the same time, TDO admissions to private hospitals has dropped from 91% in 2015 to 79% in 2018. So some of the things we're doing to combat that is the CTAC, which we'll get into in a little bit. So some of the, just to get you familiar with how the mental health process works from a law enforcement standpoint, I'm going to kind of explain some of the mechanisms. One is the emergency custody order, which is known as the ECO. The full definition is under Virginia Code 37.2-808. I've kind of diluted it into the following. A magistrate may issue an emergency custody order for an adult or juvenile based on evidence that the person suffers from a mental illness, that as a result of a mental illness, the person will in the near future cause serious physical harm to self or others, or will suffer serious harm due to a lack of capacity to protect against harm or to provide for basic human needs, that hospitalization or treatment is required, and for an adult that he or she is unable or unwilling to consent to treatment. A written petition is not legally required, but it's very helpful.
Chief, I apologize.
Yes, sir.
We're not going to have time to have you read every single portion of this.
Got it?
So can you just hit the highlights of those paragraphs, perhaps?
Absolutely. So, essentially, the ECO is, there are two ways of getting it. One, you can go to the magistrate. A family member who has a person in crisis can go and basically make a statement to the magistrate, and then the magistrate can issue an order, an emergency custody order, which would require us to come and pick the person up and take them to a place, typically, historically it's been a jail, to have them evaluated by mental health workers, in our case from the Northwestern Community Services Board. While that written petition isn't legally required, it's helpful. We can do what we call a paperless ECO. That's a lot of times what we do as law enforcement. If we show up to a scene and a person is in crisis, it's not against the law to have a mental issue. Typically we get called because there's some criminal activity that's either occurred or is likely to occur, assault or something in that nature, which would allow us to make that determination to be able to take that person into custody without a TD or an ECO that was issued by a magistrate and do the same thing. We can take them to essentially what we're doing now is taking them to the CTAC and having them evaluated by Northwestern. So, and that's typically what happens when the order is issued. It comes to us at the PD. We then go take the person into custody and transport them to a specified location so that they can be evaluated by Northwestern. Sometimes a family member or friend can actually take the person, or they can be voluntarily. They can come in voluntarily to be evaluated if they recognize that they're having a problem and are doing it that way. At that point, they wouldn't be under ECO. They would be could be voluntarily committed. But the ECO allows us to hold that person for up to 8 hours while they are evaluated by an employee or designee from Northwestern Community Services. So once the ECO process is done and they determine that the person does in fact need further, they've been evaluated by Northwestern, and they determine that the person does in fact need further services, there's the code section if you guys want to look that up. They can seek what's known as a TDO, which is a temporary detention order. And it's a similar process, but at this point what happens is the Community Services Board does the evaluation and they determine that the person is in fact in need of services. At which point they try to locate bed space in a facility to be able to put this person so that they can receive the treatment that they need. So and that's part of that initial 8 hours as well. So if it doesn't happen within that initial 8 hours, we got to start all over again. So it becomes kind of you're on a clock when that happens. So some of the regional statistics from 2016 to 2019, just so you can kind of see, this goes back. What you see in the blue there is the number of valuations. The red is the number of ECOs that were issued, and then the green is the number of TDOs. These are regional statistics. This is from Frederick, Clark, Warren, and Page, which is kind of our catchment area. Essentially the area that Northwestern Community Service Board is responsible for.
It's been pretty
fairly consistent.
Pretty consistent.
Yes, you see the evaluations are fairly consistent. What you will see is some of the TDOs starting to go down a little bit at this point. And again, some of that's going to come back to the CTAC when I start to explain that to you. So here in Front Royal, these are the numbers that we've dealt with. I've broken down the last 3 years just to give you an idea, 2017, 18, and 19.
19 through what date?
19 is just through this past month.
July.
Yes, so 228 in 17, 256 in 2018, and clearly we're on track to at least match that as we've got essentially 4 months left of data to compile. Suicidal subjects 89, 104, and 70 thus far this year. Completed ECOs or TDOs 79 and 17, 98 in 2018, and we're up to 60 so far. That other is actually other calls for service, overdoses, DUIs, domestics. We've kind of searched keywords that have kind of touched on mental issues so that we could get, that number's probably low, it's conservative, so that's kind of our local data from here in Front Royal. So that's kind of what the chart kind of looks like, the metrics look like thus far. So CTAC is what we're funding, that we got the grant funding for, and it's the Crisis Intervention Team Assessment Center. It's a secure facility staffed by the Crisis Intervention Team, which is made up of trained law enforcement officers. So it's staffed by law enforcement that have actually attended specific training for dealing with persons in mental crisis. And what makes that important is while these folks are transported to the CTAC by cops on the street, they're turned over to the CTAC and then they're in the care and custody of these CIT trained officers. A lot of times these officers, just spending time with these folks, are able to de-escalate some of these people to the point where they may have at one point in time needed to be TDO'd and transported to a facility. The officer, with their training, have actually been able to de-escalate these folks to the point where they don't necessarily need to go to a facility, an inpatient facility. So they're essentially there to keep that person safe while this process is happening, as well as keep other people at the facility safe. Our Northwestern CTAC is located on the Winchester Medical Center campus. Obviously, it's owned and operated by Valley Health. It's licensed by the Virginia Department of Behavioral Health and Developmental Services to serve as an evaluation center for individuals requiring that evaluation that I was talking about. So pretty much nowadays, every time we pick up a person on an ECO, that's where we take them to. We just take them directly to Winchester Medical Center to the CTAC, and we turn them over to CIT personnel when it is staffed. So Valley Health provides and facilitates rapid access for medical clearances. Anytime you take a person in, before they can be transferred to a state hospital for mental evaluation, they have to be medically cleared to make sure that there's nothing physically wrong with them on a medical level that would need to be handled at a hospital before, like an emergency room, before they go to one of the mental hospitals to get help with it. So just to give you an idea of some of the statistics as far as the hours that we've saved by being part of the CTAC, In July, we saved 7.53 hours. We had one TDO that went there. There were 14 transfers of custody throughout the region, and the transfer of custody time averages less than 30 minutes. August, we had a kind of a big month. We saved almost 34 hours, man hours, through utilization of the CTAC, where we were able to take clients over and turn over custody at the CTAC and turn our cops around and get them right back out on the street, providing service to the citizens of Front Royal. And I think that's pretty huge. So, and that's where we're at so far.
Thank you, Chief.
Yes, sir.
Question,
Question?
maybe not related. Last Friday or Saturday, they had an article in Northern Virginia about the OFED issue, that Warren County is the only one county in Virginia that was added to that particular list.
Oh, the opioid, are you talking about the
The OFED, is that how you pronounce it? or-
the HIDTA designation that we
Well,
got?
Warren County was the only one in Virginia that was listed into that under the national groupie that they had. I was wondering, what does that mean, since we're the only county that has this large amount of the, I guess, the drug overdose, I'm assuming, is that what that means?
No, the opioid. So we've been looking to get added to the HIDTA designation for the past couple of years, and we've not been able to make it happen.
So is that good or bad?
It's bad that we're in the situation that we're in, that we have this sort of thing to deal with. It's good that we are on that designation because it opens up some resources to us that were previously unavailable to us to be able to help deal with it. So it is Winchester and Frederick County, Frederick, and I think maybe even Clark have had the HIDTA designation for a few years now. So clearly we're kind of in the same boat that they are, but we weren't able to receive the same sort of assistance from the federal government because we did not have that HIDTA designation, and HIDTA stands for High Intensity Drug Trafficking Area. This now it puts us onto that playing field to where we can try to utilize some of those resources. Yes, sir.
Any other questions? Jake, do you have a question? I thought I saw your hand.
No, thank you very much for doing this. It is, as I said last time, an increasing problem of resources. So I think it's great that our police department is playing an active role in it. And the other thing about the increased cases is it's an enormous amount of time per person that we're having to deal with, whether it's through our police department or through the resource center or whatever. It's not ever easy and clear cut on how they're dealing with these patients.
Typically for each one, it's 8 to 12 hours, and that's not considering transport time. If they do TDO, and sometimes those transports are to Eastern State Hospital in Williamsburg, so could be a 3-4 hour transport as well. Yes, ma'am.
Have all of our officers gone through the mental health training?
So we've got probably half of our sworn staff is CIT trained, as well as a number, probably a quarter of our communications staff. I'm working on trying to up that. The trainings are sort of hard to come by nowadays. I just got 2 more in that are going to be going next month. So.
Yeah, because when I volunteered with the intern hotline, Front Royal was one of the places that only had 1 officer out of the whole batch.
Yeah.
And so I'm glad that number has increased.
Yeah, we're working towards. I'd like to see the whole agency someday get to that point.
Yeah.
But it's one of those things where a class comes up, typically you can only get a seat or 2 at a time. So.
An improvement. Thank you.
Absolutely.
Thanks, Chief.